Okay, so which of the following is the most appropriate next step in managing this patient's condition? All right, 62-year-old woman. She has diabetes and CKD. She visits her PCP for a follow-up. She has been monitoring her blood pressure at home, and her average reading is 150 over 90. Current medication is metformin and lisinopril. Her pulse 72, BMI 27, serum creatinine of 1.8 with a estimated GFR of 35. Which the following is the most appropriate next step? Um, so clearly, hypertensive patient that's not really well managed on just one therapy, right? So I think I'm between A and B. I mean, I'm not gonna increase the dose of lisinopril or switch it to an ACE to an ARB, same mechanism of action. Metformin. Okay, he's not having a diabetic problem right now. Um, I mean, I know usually calcium channel blockers are like the first line therapy, right? Like, but I also know a thiazide diuretic is also first line therapy too.
Mhm.
Uh, so I'm trying to see if there's anything in the stem that would be a contraindication to one or the other. Type 2 diabetes, CKD.
Yeah, work me through kind of. Okay, I know this sounds weird. Okay, I'm gonna try to lead you through this to think about the right answer choice without giving it to you. Okay, I want you to look at like work me through everything. What are you concerned about? Like, start from the very first sentence, chief complaint wise, and then walk me through kind of what your train of thought is.
Let's see. So chief complaint. I mean, she's just here for a follow-up of her
Okay,
diabetes and
good.
CKD. She's been monitoring her blood pressure, but it hasn't been well managed, right?
Okay,
And she's currently on metformin and lisinopril.
okay,
Her pulse is normal, BMI, normal, and then her creatinine is increased with a decreased GFR. So I mean, she has chronic kidney disease, right, which is to be expected. Yeah, you really want to manage your blood pressure when, you have a chronic kidney disease like this.
okay. Okay, good. So far, so good. Okay. And I just want you to keep in your mind, right? This is the way I think of it. One extra thing that I want to keep to your mind is anytime they give you medications, trigger in your mind to think about side effects. Okay. So metformin was a side effect that's most tested for metformin.
Lactic acidosis,
Okay, good. And how about lisinopril?
lisinopril, like hyperkalemia, or
Yeah, hyperkalemia is one of them, but also what, for ACE inhibitors and things like that, what else can it cause?
I mean, I know it can cause an increase or decrease GFR, right? Because it dilates the efferent more.
Yeah, so just know that it can affect your GFR, your creatinine level. So that's also on your mind. Okay, so you get what I'm saying. You're adding something to your clinical picture, right? They're not giving you medications just to give you medications, right? So now the question is, okay, so you've worked through it, you've understand everything. Now, what do you want to do for this patient? Because obviously the blood pressure is no bueno, right?
Yeah.
And then her creatinine, right, is not good, right? Normal is around 1 to 1.2 ish, probably around there. She's a little bit older, so maybe you have a little leeway, but definitely 1.8 is not good, right? So my question is, do you want to increase the dose of lisinopril? Probably not, right?
Yeah, no, definitely not that.
Yeah, and lisinopril is sartan, almost the same drug, right, in a sense, right? And then metformin and insulin, I mean, that's not really helping her blood pressure, right? So now you're down to A and B. So which one is the best answer in this particular situation?
Probably A. I mean, diuretic, you may have some kidney, like, you don't want to decrease their volume status even more, right?
Yeah. So you understand what I'm working through, right? I'm thinking about it, right? So you're picking the best answer, right? If you give diuretic, right, you're going to make a complication that you already have to deal with worse, right? Yeah, you lower the blood pressure, but you kill your kidney, right? That's suboptimal, right? And so then you have to ask yourself, okay, how can I lower the blood pressure without really tanking her GFR, increasing her serum creatinine too much, aka her kidney function, right? And so your calcium channel blocker here is probably your best bet here.
Okay.
Yeah. So that I'm just giving you a little bit extra tools in your toolbox when you're reading, right? Things to kind of like when you're reading a question, if they give you, certain things, you're thinking to yourself, oh, that's not good, right? So the answer has to prevent this from getting worse. You know what I'm trying to say? Like you're trying to get in the test taker's mind or test maker's mind, sorry.